Dental implants versus bridges. Which is right for you? I will explain, and I'm Rick Buck, and I've been a dentist for 16 years, so like and subscribe if you have teeth. Today we have an exciting topic to discuss, the pros and cons of dental implants versus bridges. If you're considering replacing a missing tooth or multiple teeth, this video is for you. At the end, I will quickly go over the process of both. Let's start by discussing dental implants. These are artificial tooth roots that are surgically placed into the jawbone. Here are some of the pros of the dental implants. Natural and aesthetically pleasing. Dental implants are designed to look and feel like natural teeth. Now, they come close. It's not perfect, but they provide a seamless and realistic appearance, enhancing your smile and boosting your self-confidence. Long-lasting solution. Implants are known for their durability. With proper care, they can last a lifetime, making them a cost-effective option in the long run. Preserves jawbone. Unlike bridges, for most people, implants stimulate the jawbone, preventing bone loss and preserving your facial structure. This helps maintain a youthful appearance, and we've all seen that kind of collapsed facial look that elderly people get. Comfort and functionality. Dental implants offer exceptional comfort and stability. They allow you to eat, speak, and chew naturally without worrying about other things. Implants are also much easier to clean than bridges because you can snap the floss in between the teeth, which is difficult with bridges. Now let's explore some of the potential drawbacks associated with dental implants. Surgical procedure. The process of getting dental implants involves surgery, which may not be suitable for everyone. It requires a healing period, proper oral care during the recovery phase as well. Cost. Dental implants tend to be more expensive than bridges, though both are costly. While they are a long-term investment, they may not be financially feasible for everyone. Time. The process of getting dental implants typically takes longer than getting a bridge. It involves multiple appointments and more appointments than a bridge, including the healing time after the surgery, which may extend the overall treatment duration. Depending on the bone and a lot of different factors, you can have an implant with at least a temporary crown on it the same day, or I've seen it take over a year, depending on how much bone is there to have the implant placed. So the duration could be a factor. It should be noted that some dentists will do implants with a crown in a day, and I'll do them in a day on certain teeth as well and in certain situations. However, the results are more predictable, especially a lot of times for the back teeth, if you take your time and it happens over months. Food trap. Implant teeth tend to get more food caught in them than regular teeth and more than bridges. It is important to floss them regularly to avoid gum disease and thus implant failure, because if implants are going to fail, most of the time it's because of gum disease that develops around them. Cosmetics. Gums play a big role in cosmetics due to how they form around teeth. Because the gums don't tend to fill the gaps between the implant teeth as nice as natural teeth, it could cause cosmetic issues. And those cosmetic issues are difficult to correct once they happen. Now let's shift our focus to dental bridges, which are the traditional solution for replacing missing teeth. Here are some of the pros. Affordability. Bridges are generally more cost-effective than implants, making them a more popular choice for individuals with budget constraints. But once again, that doesn't mean they're inexpensive. They're just less expensive than implants typically. Simplicity. The procedure for getting a bridge is relatively more simple and less invasive compared to dental implants. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. And these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. A bridge typically requires fewer visits to the dentist office than implants do. Quick results. In most cases, bridges can be placed in a shorter period of time compared to implants. Once the teeth are filed down for the bridge, you can at least have a temporary bridge placed right away, and so you at least have some immediate results. Now, if a tooth was just extracted, you should probably wait a couple of months until you start making the final bridge, but during that time you have a temporary bridge, so there's more immediate immediate results that are satisfactory to most patients. Achievability. In cases where gum height and bone thickness are limited, bridges can still be an option many times when implants can't. However, bridges definitely have their downsides, which has people nowadays choosing more the implant route. Let's take a look. Adjacent tooth involvement. To support the bridge, adjacent teeth to the gap need to be prepared or filed down and then crowned, which obviously compromises their natural structure. And anytime you drill in a tooth, it has a small risk of future problems as well. And so it's always best to not file a tooth down if you don't have to. Increased risk of decay. Bridges are prone to plaque buildup because there's no natural gap where you can floss. And this increases the risk of tooth decay and gum disease. Proper oral hygiene and regular dental checkups are crucial to maintaining good oral health, especially around these bridges. Limited lifespan. Bridges typically last between 5 and 15 years. While they provide a functional solution, they may require replacement or repair over time. However, many of them will last a lifetime. That doesn't mean they have to only last 5 to 15 years. Cleanliness. Cleaning under the bridge requires an extra step when flossing that can be difficult for a lot of people. And a lot of people already have a difficult time flossing their teeth. So this is just an extra step that makes it that much more difficult. Now, quickly, let me go over a typical scenario to replace a back molar tooth with an implant. First, you would take out the tooth and fill the socket with bone graft material. You then cover it with a membrane and let it heal for 3.5 months. Now, if you are uncomfortable with the missing tooth in the meantime, there are options to replace the tooth temporarily, but most of those options come in and out and add to the cost. So most people don't use them unless it's a front tooth, but there are some that do. Okay, then you have a small procedure where you make an artificial socket in the jawbone and put an implant into the socket with a healing abutment. And then the implant will integrate with the bone over the next 3.5 months, and the gums will form around that healing abutment. After that time, you come in for some impressions, and it will take a few weeks to make the final crown. So there you have it. That is it for a back tooth. Now, many people do it other ways. I don't necessarily like those other ways, but some people do it with great results, and that's up to you to decide. On a front tooth, it is way different, and if the conditions are right, it is normally done a lot faster if the conditions, once again, are right. And in fact, I actually do implant teeth faster on front teeth, and it's way different than doing it on the back teeth, and with better cosmetic results if you do it the quicker way. If you're getting a bridge, this is how it goes. So once the tooth is out, you can make a temporary bridge that same day. It will take a few months for the gums to heal if you just took the tooth out, but then once the gums are healed, you just have another appointment where you take the temporary off, take an impression, put the temporary back on, and then you send that into a lab and they make a permanent bridge in a few weeks, and then you have another appointment and then you cement that bridge onto the teeth. And yes, this stays in permanently. Which do people like more? In short, for most patients, the implants are normally a better final result, but the journey to get there is a lot easier and faster with a bridge. So most of the time I recommend an implant, especially when money and time are not important factors for the patient. But there are a few times where I will recommend the bridge, like if the person already has 2 crowns on the teeth next to the space. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.